Today we will review functional outcomes in dogs undergoing hemilaminectomy for thoracolumbar disc extrusion, but without nociception for greater than 96 hours, a prospective study. This is out of the Veterinary Journal from 2023. Going through the abstract, this prospective study investigated the functional recovery of surgically treated dogs with thoracolumbar intervertebral disc extrusion without deep pain perception for greater than 96 hours. There was a total of 36 dogs included with paraplegia secondary to thoracolumbar intervertebral disc extrusion with loss of deep pain perception ranging from 4 to 60 days. All dogs underwent hemilaminectomy and fenestration of the affected intervertebral disc, and post-operative follow-up was provided for a maximum of 180 days. Recovery of motor function was satisfactory, and this was based on the owner's assessment in 22 dogs, or 61.1%, and then 47.2% ended up regaining deep pain, and then 13.9% did not and were considered spinal walkers. And then it was unsatisfactory in 38.9% of cases, or 14. Post-operative physiotherapy, pre-operative anti-inflammatory drugs, and age had no effect on recovery. In this study, the longer time taken to regain pain perception, the longer time for recovery. The median time to recovery was 30 days. A total of 47.2% of dogs with paraplegia and absence of deep pain secondary to thoracolumbar intervertebral disc extrusion lasting greater than 96 hours recovered functional ambulation after decompressive surgery. The introduction discusses a little bit of background of disc extrusion, with prognosis thought to be related to the duration and severity of neurologic signs, with deep pain negative dogs having a worse prognosis, especially if they have been deep pain negative for days. The goal of this study was to investigate the prognosis in dogs with intervertebral disc extrusion that were deep pain negative for over 96 hours, hypothesizing that a sizable proportion of dogs would recover, but sizable is not really quantified in their hypothesis. Exclusion criteria were paraplegia for less than 96 hours, patients not having an intervertebral disc extrusion, and detection of progressive myelomalacia at any point pre or post-operative. Although this does not discredit this study, it does limit the overall utility clinically when looking at the prognosis prior to surgery given this exclusion criteria of myelomalacia. Additionally, deep pain being lost was defined as when the patient became paraplegic, so there is likely some of the dogs that had lost deep pain less than 96 hours prior to surgery. Most studies investigating loss of deep pain use the same inclusion criteria for evaluation of when deep pain is lost, but it is a limitation for this study and all the previous studies that use that inclusion criteria. Interestingly, radiographic myelogram was performed on all dogs, with some dogs also receiving a CT. All dogs also received a dose of 0.25 mg per kg dexamethasone IV, regardless of what they had for their medications preoperatively. This is something that I personally would not do as standard of care for a number of different reasons, but what was done here. Satisfactory prognosis was if the dog regained the ability to walk, even if they were spinal walker. So deep pain recovery was not considered when investigating for successful outcome, at least to some degree. This again is something that I would not do, and I would have just kept it as whether or not they were deep pain negative or not. But again, this is what was done in the study. And then they also talk about overall incontinence and bladder function at some point in the study and looking at the results as well. So going through the results, 36 dogs were included, with dachshunds being 41% of the dogs included. There is a lot of information to take away from this paper, so if you have the opportunity to download and read the results, it's definitely worth your time. To try to avoid plagiarism, I'll just summarize what was found. So approximately 14% of dogs became spinal walkers, and just under 50% regained deep pain and ambulation, meaning 40% were paraplegic without deep pain. Looking at the different time frames, just very roughly, the prognosis was 50-50 if surgery was performed prior to day 16, but only roughly about 1/3 of dogs recovered if surgery was performed after day 16. Of the 17 dogs that improved, 13 had urinary or fecal incontinence, and the average time for recovery for deep pain was 7 days and 34 days for regaining ambulation. Overall, these findings are quite interesting, and I would say that it reflects what I see clinically, that a fair number of dogs will regain deep pain even if clinical signs have been present for more than 96 hours. That said, I don't know if we can say that it's truly 50-50 based on the exclusion criteria in this study of excluding patients that develop myelomalacia even after surgery. I really do wish they would have included these dogs that develop malacia post-op, at least discuss how many of them were excluded, because I do feel the 47% might be a little bit high as far as regaining ambulation and deep pain for this group of patients. The discussion does bring up some thoughts and also articles that are well worth reading, specifically the Henke paper from 2013 looking at the histopathology of the spinal cord following spinal cord injury and how it poorly correlates to neurologic deficits. They do state that recovery of deep pain took 5 weeks in some dogs, as opposed to the usual 2 weeks that we see for most patients. I feel like the 5-week mark is a little bit of an outlier, but it's still something to consider when discussing long-term prognosis with owners. I do feel that the closing statement of the discussion sums up my thoughts perfectly. So the clinical relevance of this study is the demonstration that dogs without deep pain for greater than 96 hours, resulting from thoracolumbar intervertebral disc extrusion, may benefit from spinal cord decompressive surgery and recover motor function at a similar rate to those without deep pain perception within 48 hours. Importantly, these results should not be used as a reason to postpone surgery in dogs with paraplegia and absent deep pain, which is something that should always be performed sooner rather than later. But overall, those are my thoughts. That's the article. It's definitely interesting, and it makes me a little bit more eager to cut some of these patients that have had loss of deep pain for longer than a few days. But hopefully you found this information helpful. Thank you.